everyone. My name is Yan Jin, and I am a PhD student from Hong Kong Polytechnic University, Department of Biomedical Engineering. It's a great honor to have this mathematics lectures, topological data analysis in Hong Kong UST. Today, I'm going to share my final project about mapping muscle activation pattern in neural subject using synergy analysis. Firstly, let me introduce what is NeoA. NeoA is a common degenerative joint disease that leads to pain, stiffness, and function instability, especially in the elderly subject. They will feel walking difficulty and raising from a chair or climbing in the daily life. We can look at the pictures below. The left one is a healthy normal joint. The right one is a neosteoarthritis joint. They will have bone spurs and cartilage loss and the joint space narrowing. The traditional diagnosis will focus on imaging such as X-ray and MRIs, which will often miss the function aspect in the subjects. So in this study, we analyzed muscle activation patterns in NeoA subject using the surface EMG signals recording during the daily movement. By applying non-negative metric factorizations and the topological data analysis, we aim to uncover hidden patterns in muscle coordination and identify the subtypes of motor control strategy that may not visible through the the imaging alone. The dataset I use is the dataset I collect by myself. Well, we collect EMG data from 15 subjects in NeoA during their walking, and each subject will have 8 surface EMG sensors with 4 sensors per leg, and they will place on the following key muscles. MG is the behind one muscle in the leg. It will help with pushing off during walking. And the bicep femoris is the behind muscle assistant in bending the knee. The RF muscle is a front thigh muscle important for knee extension and the hip flexion. The last one is VM, part of the chondrocyte, crucial for stabilization, sealing the knee joint. And in this analysis, a total more than 1,000 gait cycles were included in analysis. First of all, I would apply non-negative metric factorization to decompose the EMG data matrix to find out the synergies and the activation patterns behind the different synergy subtypes. V is the EMG data, and with 4 muscles and 100 time points. W is a synergy matrix, shows which muscle activate together. H is an activation matrix showing when each muscle is activated. R is the number of synergy. The figure here shows the illustration of an MF result. The top 2 rows are different groups during walking. One group have night pain. Another group is asymptomatic. And then we can show the H matrix in the left, and they compare the different muscle synergy activation during one gait cycle. After that, we got the H metric. I will put it in mapper to analyze the muscle synergy activation. So this may have revealed the hidden structure in patient muscle coordination during walking. So the whole workflow of this study is, firstly, I do the global NMF to extract 3 common muscle synergy components from the walking EMG signal. And then I segmenting activation patterns for each synergy. segmented temporal activation curves, H matrix into gate cycles. Each cycles became a high dimensionality input sample as a cloud point. And then I apply topological data analysis mapper algorithm to H synergy separately, transforming the high dimensional activation patterns into simple graphs that capture underlying structures. During the mapper analysis, I automatically parameter use the to tuning the parameters uh, to find out the clearly cluster separately paying and non-paying subject. Here we comes to the result. The mapper graphs are generated for each three muscle synergies using their temporal activation profiles. Each node in the graph represents a group of gate cycles with similar activation patterns and is colored by the proportion of subject in the asymptomatic in red and the nocturnal pain group in blue. We can find out the results of the distinct cluster of large red nodes, which may suggest that the asymptomatic subject tend to exhibit consistent and similar muscle activation strategy during walking. In contrast, the blue nodes, the pain group, are smaller and more scattered, which may indicating great variability in muscle synergy activation among those with nocturnal pain. So, in this study, I analysis the muscle synergy patterns and using NMF and mappers, trying to find out the different subtype of muscle synergy during working in the Neo 8 group. That's all my presentation. Thank you.